Just want to end with some resources if this is an area of interest to you. There's a couple really good papers. This one is available from the American Cancer Society at www.cancer.org. And this was looking at nutrition and physical activity during and after cancer treatment. A whole panel of experts really sort of went through a lot of the issues. So if this is of interest to you, I find it a very user-friendly paper, although I read this stuff all day long, so I could be biased. But I think it's a really good synopsis of exercise and diet questions that come up for cancer survivors. And certainly you can get it through the Cancer Clinician Journal or from the American Cancer Society itself. And also, too, the big news in 2010 was that there are actually consensus guidelines for exercise in cancer survivors, the first of their kind in the world, from the American College of Sports Medicine. There was a roundtable on exercise to develop these exercise guidelines, and they were published in the Journal of Medicine, Science, and Sports and Exercise in July of 2010. So this was, again, a group of experts looking at the literature and giving information about if you're seeing these people in an outpatient setting, what medical testing may you want, screening may you want to do, what should you be maybe looking at specifically in different cancer groups. So if you're looking at gynecological cancer, looking at lower extremity lymphedema, these kind of things, and what the research says about improvements in all the different outcomes by cancer group. And if anyone's very interested too, there's also a certification you can do to work with cancer survivors as an exercise specialist from the American College of Sports Medicine. And the Canadian Society for Exercise Physiology is not being left behind. They're developing a certification as well. So I'll just leave with some acknowledgments from people that generously funded me and answer any questions that you may have.
Question for Kristin. In Ontario, a lot of our outpatient physiotherapy is private practice. And can you you're mentioning that a lot of the physios contact these patients inpatient, but some of the therapies should be offered after treatment. Do you have any suggestions of a program that you think would work out, or how we should structure it in the healthcare system?
Yeah, so the question was, how do we link this up to outpatient treatment? Is that resource available in the community? Right now, it really isn't, and I think we get a lot of interest in therapists who do work in the outpatient clinics wanting to know what to do with cancer survivors that come to their clinic for a variety of reasons, but there isn't a lot of information about what to do necessarily. So some people have specialized in it and feel like they have that expertise and have done additional training, but I think the vast majority, don't have a lot good grounding in this, and it does cause them some stress to deal with this population because they don't necessarily understand some of the issues. How to implement outpatient physical therapy so that it could be cancer survivors could access it is a good question, and I think that's our sort of next leap. Now that we've shown it's safe, we have some guidelines, then how do we get it into the community? And I think that we're still struggling with that.
I see a question in the back.
No, I just wanted to.
Hi. Yeah. So yeah, the comment was about an increasing observation of neuropathy in cancer survivors and the fallout from that. A lot of balance issues, and then people not being able to be active. They can't walk because they have these burning sensations, or they are fearful about balance and falls. So yeah, I think it's an area that hasn't been looked at, and I think it's an emerging area for sure.
Just with respect, I know you mentioned that there was no studies specifically on palliative care. Working in community care, we get a lot of requests from families and clients. Do you have any sort of, from your reading, have any guidelines of what you suggest to us?
Yeah, so the question is about palliation. There is a lot of requests for physical therapy interventions, but there's not a lot of guidelines. There has been limited research, so it's hard to say. Certainly when you start talking about metastases, a lot of bets are off. And I should have mentioned that a lot of the research has been done. If you have a metastatic cancer, you're not included in these studies, just because there is a fear of fracturing of long bones, thoracic spine, things like that. I think the research that has been done has really focused on function. So maintaining the core muscles that you need for functional things like quads, so you can get up off chairs, a lot of arm strengthening, And that's where it's sort of gone from, so maintaining function as much as possible. If you're working with METs at the same time, it's really difficult. And I think there's a group in McGill that's trying to look at metastatic cancer and what can be done with activity. But it's an emerging area. And we can probably talk after. I can give you some more information. Yeah.
How can we get something like the wellness center west? I know it's in Ontario, right? So a 10-week program for any cancer patient they can get show up.
Yeah, the question is, how do we get the wellness program that's in Ontario and some other jurisdictions to BC? The question is, it's happening sort of as in a test realm. The first group of it actually happened in July at the BC Cancer Agency. We're doing a second round starting in November. Some of the people in the crowd have been involved with that. Okay, we can talk about it. So the wellness program is a sort of 10-week cancer survivorship program where they go through physical activity, healthy eating, stress, survivorship in the future, all these sort of issues. It's once a week for 10 weeks. So it's mostly providing education and trying to link with community resources, but at this point we don't have a lot of where we can tell people to go after they have the initial 10 weeks. But it's moving in that direction, and certainly the research is really focused on how do we implement this research we now know is beneficial. How do we get that into the community, for sure.